Welcome back to another Effective Cannabis Conversation. I'm Debi Wimberley, and today we're hanging out with someone who's been shaking up the wellness world in the best possible way, the one and only Luna Stower. Luna is a global force in education-based advocacy, known for bringing culture to compliance, legacy to legal, and people to policy. From shaping how communities think about plant therapies to driving regulatory reform. She's built a career rooted in justice, clarity, and real-world impact. Luna, I'm excited to have you here. Can you start by telling us a little bit about yourself and the work you're doing today?
Yeah, absolutely. My name is Luna Stower. I run a freelance marketing consultancy here based out of the Bay Area where I'm born and raised. I've been smoking, growing, and working with this plant since the late 90s when we legalized here. I got my master's in teaching and taught in public schools and prisons and juvenile halls for most of my career before coming full-time into cannabis about a dozen years ago. And I absolutely love it. I'm a patient. I'm an advocate. I've helped work on the early equity program here in Oakland that was copied and pasted around the country to really help acknowledge the harms done by the war on drugs. From the state level to the national level, really love pushing policy change. As we're seeing, you really can't do much without, having a positive regulatory system for us. So a lot of folks know me as being the first employee at Jetty Extracts. Back in 2014, 15, I started out with them. They're now one of the biggest brands in the vape space. And then I worked for iSpire, which is the inventor of the vertical coil vape pen. So I work for one of the largest vape manufacturers in the world. I'm bilingual, so I get to travel around the world and get to educate all these folks in new markets on what worked and what didn't work and how to avoid some of the pitfalls. So really, it's, advocacy and plant medicine first. And then obviously conscious capitalism. I always say love is lucrative. We can have an industry that's thriving that doesn't forget the movement and all the people that, came before us that really lost their lives, their children, their dogs to these raids and this very unjust, highly punitive system that really is a conspiracy against bodily autonomy and medical sovereignty as we're seeing it. So really excited to be here. I'm a huge fan of you, Debbie, and this is the work you're doing. We got to get the word out. Everyone talks about normalization and destigmatization, and media is a huge part of that, right? If you can't see it, you can't be it. If folks aren't accessible, if we don't have role models in the space doing the work, it's hard to imagine yourself doing the work. So thank you so much for amplifying voices like mine and being such an incredible force for good.
Well, thank you very much for that, and thank you for the work that you do, because we need someone like you out there that's advocating for this plant all the way around, for patients, bringing normalcy to it into the medical field, and then making sure that we just understand that this is a plant that touches everybody if they consume it, and that it's important regardless of what your reasons for using it are. But we need to understand how to use it safely and
Right.
what works, and having safe medicine or safe product to consume. So thank you for that.
Well said.
You unpacked a lot there for me. So I'm going to just start first by diving in and talking a little bit about how you've worked for so many vape products and companies. And I started in the cannabis industry in 2015. I was forced into it by being abandoned by my doctors. And so I have a lung condition, and I was told I should never smoke, and which I understood. And then I started learning about vapes and flower vapes and learning how to utilize them. But I've seen the vape industry really change in 10 years.
Oh, yeah.
And understanding the difference between a flower vape and a pin vape, as we call them, is
Mhm.
very important. So can you just explain a little bit about what you've seen change over the period that you've worked with it?
Yeah, absolutely. I mean, I was a public school teacher, like I said. So really, I had the 10 and 10 rule. If you're 10 seconds and 10 feet from someone, you can medicate and not get caught. So I'm a traveler, I'm a patient, and it was very difficult to have discretion and ease of use. And there's a lot of folks who have mobility issues in their hands. They can't roll joints. They have issues with being able to consume flower with combustion. And so I really see vapes as it's not meant to replace anything necessarily. It's one of many tools in your tool belt. It really is instant, right? right? If you're having an anxiety attack, if you are, having insomnia and you don't want to get up and turn the lights on, you can reach over, inhale on something a couple times and go back to sleep. So for me, my number one thing is access, right? And flower is very obvious. Everyone knows what it looks like and what it smells like. The authorities know what it looks like and smells like. Vape, now that we have e-cig and other kind of form factors, it's a little bit more private and discreet and a little bit easier to kind of, be able to access these medicines in a way that's not so obvious and so incriminating. And I think that that's how I've seen it change, is people are seeing it, especially during COVID when people weren't able to like have time away from their kids. They're in their office all they, they can't really smoke indoors when it's cold outside. A lot of places are snowing most of the year. It allows people to be able to consume their medicine in a way that feels in alignment with what they need. It's not necessarily an edible that's going to last multiple hours. It's a kind of a way to microdose and really be able to kind of titrate on and taper off, and be able to have real precision. If you know the percentage, and kind of how many puffs it takes, not the same thing happens with flowers. Sometimes you take one hit off of a joint and you're high, or it takes the whole joint. Whereas with a vape, if you buy the same product and it's a consistent product, you know exactly what one puff off of that vape is going to do. So it really allows for, folks who are not comfortable rolling joints or having flower around to have something in their pocket that, that they can be at a happy hour and pop into the bathroom or pop outside, or share it with folks. And it feels more like a modern, advanced form of using it. Also, it really is, if you get a good full spectrum vape, it really can be as beneficial, as using the whole flower and the whole plant. And I think that it's really important that people are able to have something that can help condition their endocannabinoid system in an easy way that, every market has them now, right? Some people don't have good flower. It's hard to find good flower in some of these dispensaries, but you can always find some good concentrate or some good oil, and it lasts a really long time, right? So if you spend $100 on cannabis flower, that might be get rolled up and smoked in one session or two sessions with your friends at a party, versus if you spend $100 on a 1 gram vape, that could last you months depending on how you're consuming it, because you're using, it's a concentrate. It's literally concentrated. So there's a lot more bang for the buck in a lot of senses. And you don't have to have the papers or the bong or the pipe. It's already like an all-in-one system that you just make sure that the battery's charged and you're good to go.
And you just unpacked a whole lot of things there that I think that a lot of our audience may not be so familiar with, since we are generally medically focused. And so, just understanding that there's these different types of vapes, there's bongs, or different products that you can utilize. We do educate on this, but it's not something that's focused on real heavily. So thank you for sharing that.
Mm-hmm. Absolutely. This is the point of having people that are, medically focused also be in the space, is that there's a translation happening.
Well, and that's the thing that we struggle with in this space, is being welcomed in sometimes to these other events and other things, because we are so medically focused. If I didn't have medical cannabis, I wouldn't be here today. I wouldn't be here, that we know. And so having access to it and learning how to utilize it correctly becomes really important. So, it's really important, though, that we're accepted. And I believe in collaboration, which I know we're going to talk about a little bit here later. And that, we're all needed in this space. There's 8 billion people on this planet. It takes all of us working together to make this industry right and work properly. And,
yes. And I believe all use is medical use. That's my personal opinion. It's a
I do
controversial
too.
one, but I really believe that all use, even if it's for recreation, even someone just having a glass of wine to unwind, or, I just want to take the edge off, that is a medical use. That is dealing with low level anxiety. That's dealing with mood disorders. That's dealing with, mental health things. And we just think that we just want to get a little buzz. But why? Because we're treating an imbalance or a dis-ease. It doesn't have to be a disease, but it's an unease. And so, yeah, I believe, when California went rec and we weren't allowed to use the word patient appreciation day or patience anymore, I was furious, and I still am. I really believe that and also it feeds into this stigma that being sick is something's wrong with you, as opposed to being like, you're just differently able. Like you were saying earlier, you're immunocompromised. You can't travel to all these things. There's a downside to that, but there's also a beauty in that. You're able to hold down the fort. You're able to create this kind of online content. You're able to do deeper work when you're not on airplanes and always transitioning like I am. I'm not able to do deep dives in ways that you are. So honoring folks from the disabled community or differently abled community, honoring the fact that we all have different bodies and different types, that helps grow who can access this plant. Not everyone wants to see a 20-year-old taking fat dabs. That's not what all use cases are. It's women that look like you that are later in life that have these different experiences. We need all of these personas to create and put out the olive branch to cannabis curious consumers who want to move away from big pharma.
You're speaking music to my ears. Let me tell you, this is
It's
exactly
the
what I
truth.
believe. I believe that we should be encompassing of everyone because everyone can benefit from this plant, I do believe. And
Yep,
I think
agreed.
that anyone that is engaging with it should want to know how it's working for them, regardless of why they're engaging with it, because you're interacting with a system that you were born with that helps control and navigate all your other systems that you live with, which is called the endocannabinoid system. And so we're really on a real big push, especially I am, to just educate about that system. There's so many people that don't even know that it exists, and we still have a lot to do. We're
Well
not going to
said.
run out of things to work on, that I can promise
No,
you.
definitely not.
So you've built such a powerful presence in the cannabis space. What originally pulled you into this space for advocacy and education? And was there a personal moment or experience that changed everything for you?
Yeah, I mean, I didn't really enter cannabis. It kind of raised me. I'm from the Bay Area where, we legalized one of the first places in the world to legalize for medical use. Northern California, Trinity County, I learned how to grow organically, permaculture, no-till, regenerative. And I learned that cultivation and care in the Emerald Triangle with legacy growers who treated the plant as medicine, not as a commodity. And I watched it heal my grandmother while the state criminalized the same people providing that care, like Brownie Mary. And it flipped a switch that never turned off. I went to UC Santa Cruz and we had a 420 day where we hotboxed a meadow. There were so many people that even in open meadow, there was like a cloud. And I remember the cops coming and I was like 18, 19. I was a freshman. And I was like, wait, why are we getting in trouble? It's like, it's legal for medical use. We're outside, we're college students, and we're just peaceful. We're literally just having a picnic and hanging out. And the anger and the resentment of the police, I was like, oh, this is a big thing. And then I got kicked out of the dorms for having it. I was supposed to be a residential assistant the following year and they rescinded my RA application because of it. And so I'm not going to say I was a victim of the drug war, but I definitely felt a victim of prohibition for sure. And I was like, oh, this is messed up. And that's when I really started working in prison abolition. I learned about women in the war on drugs from an ACLU conference that I went to and realized that traffickers were using women's bodies to get drugs across. And they were the ones, suffering in prisons for being mules, basically, and seeing how cannabis interacted with all the things that matter to me and the environment, social justice, feminist studies, and feminist lenses on things. And so that's really what got me started, and I haven't looked back.
That's that's uh, that's the messages we need to be hearing. I think is that a lot of stigma was built into that at the beginning that you didn't even think was existing, but you were having to experience it as you were talking about this event that you went to on 420. And just learning about what 420 events are, maybe not everybody understands what a 420 event is. So would you mind explaining a little bit about a 420 event?
So 420 was created by a group of students in Marin that would have a wink, wink, let's meet at 420 after school. And it just kind of blew up and has now become a worldwide phenomenon. But it's just a whistle call to all cannabis users. When people are on Craigslist saying they want 420 friendly housing, it's a way to say, I consume and I hope that you're okay with it. So it's really a cultural nod to consumption because really the most iconic element of cannabis is the community element. No one really usually consumes alone. The concept is you pass the peace pipe, you pass the joint, and don't bogart it, right? So it's definitely this kind of collective, like, we're kind of a renegade community that has to kind of hide what we do. And so we use code to kind of get together and have these things. And then 710 became the day for oil because oil's upside down. 710 upside down spells OIL, 017. So it was also a nod to, instead of it being more about smoking, it was more about the concentrate community, the dabbing community, the vaping community. So now we have 420 in April, and then we have 710 10 in mid-July. So it's definitely been something that's kind of us leaning into and reappropriating this isolation and stigma that we've been given, and we're kind of like owning it and leaning into it and kind of claiming it as our own.
Do you find that most countries, because I think you've at least reached 40 countries from my last count,
Oh yeah.
maybe more, but do you find that most countries honor or recognize the 420 and the 720?
Definitely the ones that are really aware of California culture, which is most of them. So there's definitely events that happen in Spain and Germany. There's definitely events that happen across South America, Colombia, Argentina, and Chile, and Brazil. Because California Cool has been exported to so many places, they absolutely know what it is. And they also are hiding it even more than we are. They're even farther away from winning the hearts and minds of the people, the general public, and their regulators. So it's actually makes sense that they would be using that, because they also, they use the word magic broccoli or happy cabbage. And there's still a lot of, coding that we have to do to keep this safe and keep our community safe from over policing and trouble with the law.
And I hope this changes sometime soon. I'm so tired of playing these games that we have to
It
play to be
will.
able to
It's
talk
happening
about this
slowly.
plant.
Yeah, we're getting there.
Yeah, I know. Not fast enough, if you ask me.
I agree.
It needs to change because it's impacting the ability that we have to really make a change and people's quality of life and their health. And that's what
Amen.
we're looking for, because we have a very sick country and a very sick world.
True.
So you come from a strong teaching and community background. How do those early experiences shape the way you show up in this work today?
Yeah, I mean, my first job out of teaching was doing brand ambassador work and sales for Jetty and doing these patient appreciation pop-up days in the dispensary. So teaching really trained me to translate complex ideas without talking down to folks, repeating similar ideas, basic ideas, how to turn on and off a battery 5 times on, 5 times off, hold it down for 2 seconds without getting annoyed. So it's that patience, that compassion, that kind of professionalism really translated, because community work really taught me who gets left out when systems are built fast and for profit. And that combo still drives everything I do. It's education first, people first, always.
Thank you for that. We need that for sure. So there's still a lot of educational gaps in this space. And so where do you see that we can build on it, and what do you see that's hurting it the most?
What's hurting it, I think, is a lot of the meta bans. So we're not able to advertise or educate on Facebook and Instagram. LinkedIn, not everyone's on it. That's a very B2B platform. TikTok is still very young for a younger crowd in a lot of ways. And Twitter and X has just lost kind of their cachet. Obviously, they allow for cannabis advertising, but I think that the social media bans has really hurt us a lot. And so we need to get to a point. This is why rescheduling is going to be important. I believe in descheduling, but there are some benefits to reschedule. And I think that some of the lawyers that are covering their asses at some of these corporate places, to just because the terms and agreements are, you can't promote or endorse the use or sale of a federally illegal substance. And that's a very gray area, very subjective. And anyone can say that even education is promoting the use of something. So we need to get past the social canna ban.
We definitely do. And I think that education is the one thing that's going to set us all free. If we can't educate about it and inform people about it, then how are we going to ever move forward? I
Yep.
think that's really important. And I think that we need to be able to talk about this and educate at the universities. And I think this should be taught in every biology school, science class,
It's
and
happening.
every
Stockton
in every
University in New
grade level.
Jersey, there's like a bunch of cool universities that have cannabis courses now. It's fabulous to see. It's really great. Oaksterdam University has done a great job at this. The UNLV, the University of Northern Las Vegas or Nevada, Las Vegas, they had a policy summit during the time of MJ BizCon that people went to. So we're definitely seeing. I'm on the board with a Vape Safer, and we're working with a student at the University of Michigan who's doing a white paper on vape safety and things like that. So yeah, we're breaking into the academia space big time.
We need that, because I think that we've been trying to break into the colleges and let at least share with them. And I've done it at a few colleges, because we create the monthly newsletter, educating. We bring the science, and then we bring the testimonials or the person's story to back up the evidence of what the science is saying. And
Right.
so it's like when I was going through my medical training, as a medical technologist. I just got the book training. I didn't know how it backed up anything with the patient. And so it's like, if we could just get this into the colleges for the students that are taking these for their courses, they could then at least see as they're studying it, oh, this is really how this works. This really how this interacts with a person's body, because everybody's body is different. This isn't just straight across the board science and everybody's going to act the same. And we find that we just can't stick cannabis education into the curriculum and make it a required, because then we have to take something out. And so it becomes a push and a pull. What do we take out? So I really hope to see this move forward, and that it's not just an elective, that it is required, because everybody was born with this system and doctors need to be knowing about it.
Yeah, when I was lobbying in DC, I met a group of nurses when I was waiting out in the halls. If anyone's ever lobbied, most of the meetings happen out in the hallway because everyone's packed into the senators' rooms. And I was hanging out with a bunch of nurses. And anytime I meet doctors and nurses, I'm always like, did you get education on the endocannabinoid system? And she was like, actually, yeah, our professor like had someone come in and teach a whole course on it. I was like, what? She's like, yeah, like North Carolina is really progressive. I'm like, what? And then UC Berkeley is doing a research project that my friend Itzhak Ali, who runs Echo Certified, is doing research to, like you say, back up from practical perspectives. Yeah, and we're seeing it. The Canavision Institute is doing this work with accreditation. So yeah, we're creeping in.
Good. Let's keep it going. When you first stepped into the industry, what did you see that made you think, okay, something here needs to change?
I mean, definitely the corporatization. Obviously, I call it kind of corporate amnesia. It's the industry wanted legitimacy, but no accountability. They wanted profit without any history, and they wanted to scale without really caring. So, culture was being stripped while the people who built it were being erased. So that's been something that we've been really trying to do, is remind people this was built on the back of AIDS patients and folks of color and indigenous people. And that's the real story. And we're seeing it at MJ BizCon. There was an Indigenous Cannabis Industry Association, Latinas in Cannabis, Minorities for Medical Marijuana had a front stage at the hub. So we are kind of bringing color back into cannabis and making sure that it serves the people that need it the most.
And that's really important. We can't lose sight of who has brought this plant here forward the most and worked the hardest, I think, to make it. If we didn't have their knowledge, we wouldn't have the industry that we have today.
True.
I always say that it's the legacy market that's taught us so much to make the industry that we have now, be so smart or be so effective. And so we cannot lose sight of where that comes from.
Yes.
You talk a lot about bridging culture to compliance and people to policy. What does that look like specifically in the medical cannabis education space?
Yeah, to your point, it's like, what's practical, what's real. It's honoring lived experience while meeting clinical standards, right? This needs to be safe. This needs to be something that doctors don't feel like they're going to lose their MD over. And patients don't need more gatekeeping. They need accurate dosing, terpene literacy, and informed consent. I believe that compliance should protect people and not silence them. And so that's the most important thing. That's why I work with regulators, is we don't want to wait until things get passed down to us and then try to work with it. We want to actually sit with them at the table so that we're a part of it.
This medicine, and I call it medicine, it definitely works very different than what we've been doing pharmaceutically.
Yes.
And so we need to understand that everybody's body is actually different, and it's going to react differently to whatever they're consuming. And so it's really important that we're putting the patient in the forefront, and that we're building a partnership with our doctors, and they're partnering with us. And this is one of the things I've struggled with a lot. As much as I've learned and taught myself, I'm still just one voice. You're just one example. And I don't think I am. I think there's a lot of people that are making accomplishments like I have, maybe not for the exact same health conditions, but they're making progress. And we need to be recognized that we do know something and that we're doing better for our health, because I guarantee you doctors couldn't do for me in 3 decades what I've been able to do.
Yep.
So it's really important.
Yep. It's a deep knowing and a deep connection to our nature and our bodies. That's what we're coming back to these days.
Yes. So you've been a trusted voice and influencer in this space. How did that evolve? And was it intentional, or did it happen naturally as you just spoke up?
Definitely not intentional. It definitely happened naturally. Telling the truth consistently tends to do that, right? I spoke up when it was inconvenient. I corrected misinformation. I call out bad actors, and I don't water things down for brands or algorithms. I just wanted to create trust, and trust is what followed.
And that's something that's really kind of still hard to find today. I'm going to just be real honest. And so thank you for you stepping up and always doing that. And I can always count on you to do that because we still have some bad actors, unfortunately, in this space, and they don't step up and try to bring forth the truth. So thank you for that.
Yeah, I mean, I think that being an influencer has become a dirty word, you know? So it's like, are they credible? Are you getting paid to do it? And so that for me, it's like all about accuracy, transparency, and humility. That's what makes my influence credible is I say what I know what I say, I cite my sources, I admit the limits to my knowledge, and I don't monetize people's fear and try to make the most out of it. There's a lot of people out there that are making their careers off of fear and misinformation, and I'm really against that, you know? And in medical education, trust is earned, not branded. So that's what I believe that we're doing.
And I always get told that, you need to lead with fear because that's what people attract to. And it's like, I can't
You
lead
know,
with
I
fear.
think that you can lead with urgency. You can lean with an advisory message with something that says, "Hey, you might want to listen up, and this may help us." And you want to bridge people's curiosity and survival instinct, but not the fight or flight instinct. You don't want people in that mode where they're not making good decisions. That doesn't help anyone.
Right, exactly. But it's like, I believe in general, anybody that's struggling, especially with a serious health condition, they have enough fear already.
Yes.
They don't need any more. They just
No,
need
they
to
don't.
understand the curiosity, which is one of my favorite words. And that when you're curious is and you're willing to listen and learn is when things can change and happen. So it's really important.
True.
How has your approach to influence changed now that the industry is more regulated, more crowded, and more complex?
You just got to be sharp and more selective. They always say less noise, more signal, more substance. So fewer hot takes and clickbait and things like that. We want more infrastructure. We want, to build. We want to have more policy work and education that actually changes the outcomes, right? So, at the beginning, it was just like, what is cannabis? We've moved past that. People already get it now. It's like, how do we do it safely and effectively and scale it?
I'm told often that I should be an influencer.
You
And
obviously are. All it means is that you're influential. The problem is that people have gotten paid to be like, and use code Luna25 for a discount. Like it got kind of, oversold. You can be influential without being an influencer, and you can also be an influencer without being influential. So it's really about, who is your core audience and what have you done to actually prove that you're doing it. If you only pop up and talk about, social justice causes during Black History Month, no one's going to buy it. If you're only talking about women during Women's History Month, no one's going to buy it. If you're only talking about queer LGBTQ community during Pride Month, no one's going to buy it. You have to be consistent throughout the whole year.
thank you for saying that because I keep telling everyone I don't really want to be an influencer. I just have a message that I want to make sure everybody understands that they have an endocannabinoid system and that it is something valuable in learning about for your health.
Yeah.
Because I really want people to understand that they really do have a need in understanding that just from a basic standpoint, if nothing else.
Yes.
Being an influencer meant something very different 10 years ago. Do you feel it still carries the same impact or has the landscape shifted?
No, I really feel like it's kind of a dirty word. I jokingly call myself a LinkedIn influencer because I have 30,000 followers and I get a lot of, traction on there. So I'll be okay with a LinkedIn influencer. But, no, I don't think that it still means the same thing because reach without responsibility is useless now. If it's not really got, authenticity and grit and stickiness, it doesn't mean anything. Impact comes from true depth, not just follower count, right? People can smell performative advocacy instantly and you want to stay away from anything that feels like greenwashing or pink washing or rainbow washing, like I said before.
Very good. Thank you. What would a truly equitable, accessible, science informed health ecosystem, one that includes natural plant therapies, actually look like?
I mean, adult use access. If plant therapies are not available alongside pharmaceuticals, we don't have real healthcare. So community-based research is really important, fair regulation from the legislators, and, systems that trust people with their own bodies. We can heal ourselves. We really can.
I think that's the biggest thing you said right there is being able to trust us with our own bodies. One of the things that I learned through understanding about cannabis and fighting for my life is that when I allowed myself to sit in a quiet, comfortable space and consume, I could hear my body speaking to me.
Mm.
And now I've learned how to really listen to my body, which is really interesting, being medically trained, not something we're taught.
Of course.
And we're just taught to just ask somebody for what we need. They'll hand it to you. You'll
Hmm.
relay a message back.
Yep.
And learning to sit and listen to your body, and your body speaks to you every single day. And that's part of the ECS, because your ECS is different every single day and it functions for you every single day differently. So I think it's really important. And I'm starting some new training in the new year coming up in 2026 on how to do this and how to actually learn to listen to your body. Because when you do that, it's truly amazing what can happen and what you learn about yourself and how it changes your health.
Yeah, not to get too woo-woo, but people talk about the age of Aquarius, and we're leaving the age of Pisces, which is kind of ruled by the I believe. It's the priest, the teacher, the parent, something outside of yourself, the doctor. And the age of Aquarius is the saying for Aquarians is I know. It's a deep knowing. That's why people are turning to psychoactives and psychedelics, is why people are moving into the mushroom space and into the self-healing space, is we have to start to learn to trust our own bodies again. It is an issue of medical sovereignty and bodily autonomy, and we need to start talking about it as such. Because, like you said, the endocannabinoid system is the master regulatory system for all of our systems: immune, nervous, endocrine. Nothing functions without it. So it is a conspiracy against this plant to not let us. And it's all mammals, right? I give my dog cannabis. She has cancer. I'm giving her THC and CBD RSO. Like, all of us have been co-evolving with this plant since the beginning of time. It is literally our birthright. No one can take it from us.
And when you talk about RSO, I just want to do a little clarification here. That stands for Rick Simpson oil.
Yes, the
Which,
true term should be full extract cannabis oil. Rick Simpson was someone who made it famous, but really it's full extract, which just means that they use a high grain alcohol to make a distillation, and then they remove the solvent, and what's left is like a very thick sludge, which is a compilation of its full spectrum. So it has all the cannabinoids, it has the phytocannabinoids, and it's really, really dark because it has all of the nutrients and all the good stuff in it. So it's usually used to treat cancer, or for people who have a really high tolerance that need large amounts of it. It's usually a therapeutic product. The Beard Bros make it. Julie from Proof here in California makes it. Mara Gordon is famous for Aunt Zelda's and the oil plant. She was famous for helping treat children with it, and it is really powerful medicine.
it's really important to understand the recipe and understand how you're making it, because the way Rick Simpson was making it in the beginning is not how we would recommend anyone to make it for medicine at all. He was
No.
using it for a topical for skin cancer,
Yes.
and people are consuming it in a different way. And that's the only
Yes.
reason I bring it up, because I always am cautious about people hearing that and then just looking it up, finding a recipe, building it themselves.
Right, but what was it for? Right.
Yeah. So, we always just like to bring that up when that comes in any conversation, so that they're aware that that's, and finding correctly made and good product is also really important here.
Yes.
Especially when you're talking about something, any condition, but when we're talking about cancer, that's the field I specialized in. And so actually giving people hope that there's something that might help, and then it causing harm, is not something we want to do.
No, yeah. For example, THC is estrogenic. So if you have an estrogenic cancer, you should be doing more of the CBD and the CBGs. I found out recently that actually cannabis doesn't work on my dog's cancer. It's mast cell tumor disease. It doesn't respond. Mast cell doesn't respond well to cannabis. So now we're just using it for symptom remediation and keeping her calm, and quality of life stuff, right? So yeah, it's not a panacea for everything. You need to be responsible when you're using this. There are folks out there in the medical field that can help. Enthea Care is another fabulous group. That used to be a group of nurses. Trusted Canna Nurse was her previous life. Her name's Megan Mbenge, and she just started Enthea Care, and she's doing like that. She provides the medicine, but also really coaches people through it. So it's fabulous to see that.
And Dr. Bonnie Goldstein is another one that is working heavily with cancer patients and with children. And so she's another one that's a good resource. We're missing a lot of good resources still. We don't have enough medical professionals involved. And that's why we have everybody on the team at the newsletter is either a certified cannabis coach or educator, and have been through all the training that we set beside doctors and nurses taking the exact same training. We just don't all have the same medical training. But this is a field that is out there and available. And it's something that I wish that a lot of medical professionals would partner with us with, because they don't have the time. I've been studying this for, it'll be 11 years, and I learn something new every single
Every
day.
day.
And trying to understand for every medical condition, you can't. It takes a lot of time to learn that. So that you can't, I get frustrated when somebody's like, I can treat you for anything. And this is why we have
Red flag.
specialists. Yeah. So, it's really important to understand where your strengths are and where your weaknesses are and work with people that are working within that field. So, but doctors could really benefit from working and partnering with certified coaches and educators.
Mm-hmm.
And bringing, even asking someone, if asking your doctor, can I bring my coach or my educator with me to my appointment and have this conversation?
Yeah, my friend's mom who has cancer, her oncologist at Summit Hospital here in the Bay Area recommended cannabis for her, and she got little Kiva gummies, and it helped her with her symptoms. So there are oncologists out there that are recommending cannabis.
Yes, and that field is coming on a little bit stronger than some of the other fields in this, because I think they see that it does help with. I mean, I was doing this back in the late 70s when I was working in it, and was not legal by any stretch of the imagination, but we had patients that were using it, and we could see that it helped with nausea and sleep. We didn't even know we had an ECS back then. So, the knowledge that we have now is so far greater than what we had back then. And I lost my father to lung and brain cancer, and my brother-in-law as well. And I would have given anything to have had an opportunity to use cannabis with either one of them, to show them that maybe, at least if nothing else, to give them a better quality of life while they were here.
Yes. And
So
Ethan Russo has done a lot of work in this too. And yeah, we have a lot of people that are fighting for this. I'm so sorry for your loss. And I feel the same way. We really need more options.
Yes, we do. So you spoke about your dog, and I knew that your dog had been diagnosed with cancer a while back, and you've been kind of keeping us connected with it a little bit on a WhatsApp group that we're in. So if you don't mind me asking, can you just share a little bit with what it was like learning that and what you had to go through to get the help that you needed? Because I think that people don't think about it for their animals that often.
We found a little lesion on her back of her leg. We had it biopsied, and it came back as mast cell. We had it removed, and the final biopsy came back as high grade, which means that it's coded into her DNA, and it'll take her out at some point. She was 8 at the time. She's a beautiful little healthy pit bull staffy mix. Nube is her name, which means cloud in Spanish. And we decided to go with the chemo route. But they said, they don't fund dog cancer research. So unfortunately, they did like a study that's already almost 20 years old with just like a handful of dogs. And so, it doesn't work so well on mast cells. So a couple months ago, when the chemo stopped, another lesion came back in the exact same spot, less than an inch from the other spot on the leg. So we had that removed. It came back high grade. So we have an oncologist appointment on Monday. I don't believe the cannabis necessarily made that big of a difference, because within 6 months, it was right back in action. And even the folks at Right Ratio told me that cannabis isn't really known to work for mast cell disease. So really, it's kind of it's a losing battle. We're trying to use, turkey tail and cordyceps and other supportive things. We go to Dr. Richter, who's a holistic vet here in the Bay Area, who's part of the cannabis veterinary community or veterinary council. Dr. Tim from Vet CBD is involved in this too. I've gotten a lot of help from a lot of different folks, but at the end of the day, it's really hard to see something that you love so much that you can't explain to them why they're suffering, why they keep having these tumor removal surgeries and chemo, which isn't as bad for dogs as it is for humans, but it's definitely stressful. It lowers their immune system. It messes up their GI tract and really kind of depresses them a little bit. So we're having to decide if we're just going to kind of keep fighting and taking them out as they pop up, or trying to keep going down the chemo route. I spent over $50,000 on her this past year on all of these therapies, and trying to get her the best care in the world. But there's only so much that you can do, and it's just a matter of time. And so, there's electrochemotherapy, there's all these other things, but it's definitely been a hard journey, and we've learned a lot through it. And it's kind of cool that something that I've put so much of my time and energy and love into, because I was, part of one of the founding members of Jetty Extracts when we did the shelter project project, one for you, one for cancer. They currently have 1,400 patients enrolled. There was 300 at the time that we started. And so something that I've been pouring my heart and my soul into, I was finally able to actually reach out to my community and say, I actually need help. I need good medicine. I need some advice, and kind of all this work I've been doing for more of an advocacy and a business level ended up becoming very personal. And I was able to tap into like some of the best oncologists in the space and some of the best healers in the space that I've just known as friends and gone to these events with and hung out. And then I called them as a patient crying in need, just like, you don't expect to ever need it, but then it kind of came full circle. So I'm really appreciative to the cannabis community for stepping up, and thanks for asking about Nube.
Well, thanks for sharing it.
My world.
We wish her and you all the best luck, and hope that at least you can find some way to provide her with a comfort and a level in each day. The one thing I say always, it's not about the amount of time I have left to live. It's the ability to have the very best life possible today. So
Amen.
that's what I strive for. So
Beautiful.
how can legacy knowledge, lived experience, and formal medical training come together instead of competing?
Yeah, I mean, they're complementary. They're not competitors, right? It's just by respecting each other. Oral tradition plus a little lab data never hurt. Healers with clinicians. I always say it's the roots in the suits, and ideally roots in a suit, like it's like or you're a suit that became a root. It's like we need to kind of have experience plus evidence. They work together.
We have to have them together. We cannot do this, I don't think, the traditional way of doing traditional research and get the answers that we want. I've been studying this for 10 years. And I ask people that have the same medical conditions that I do, because I believe there are similarities.
Yes.
But I can guarantee you the responses are different for each one of us. And that is not what we see in traditional medicine. And so we're going to have to rethink the way that we do this. And it's bringing value to people's lives, and it's returning them to their families. I can tell you, my family, I didn't have a life with my family. I was had a 24-hour caregiver, couldn't even take care of myself, participate. And here I am doing this now. And it's because of one natural plant and learning how to do this. And we want to be able to return that to everyone that we possibly can. And we can only do that with knowledge. I'm writing an article for our January issue coming out about the battle between medical and cannabis and the patients in the middle. Because right now we have some providers, professional medical providers, that support cannabis.
Right.
We have a large number that do not, and they still can't get past the stigma. Then we have the cannabis community that is fighting and trying to bring it forward to some degree. But then we have the other part of the cannabis community that just wants to stick with the recreational, high THC. And we have a whole community in the middle who is the patient that is stuck. And we need to stop that. We need
Absolutely.
to bring a voice.
I'm with you. We're doing it.
So we're bringing advocacy to action in January.
Yes.
So, and all the work you do, what brings you the most joy, and what continues to be the toughest barrier to push through?
I just love being in a community that understands mental and physical health. I just think that having a trauma-informed work life is just irreplaceable. Coming from the public school system and the government systems, there's no place for mental health days. There's no place for people being disabled. And in our community, it's like if someone is freaking out or someone needs something, we instantly know what to do. And we're just already in the mode of medical. So there's nothing like, no one's worried about sharing that they're going through a really hard time. We step up. So, my joy is watching people reclaim agency over their own health, and building that community with the people around them. And I would say, the hardest part is fighting extractive greed systems that profit from confusion and exclusion and prohibition. But it's still worth it. All of it's still worth it. It's just, it's the righteous rage and the beautiful struggle and the fight for freedom. And we're just going to keep going until this plant is as accessible and safe and affordable and easy to get as possible. That's the goal.
Well, thank you.
And free all cannabis prisoners, of course.
Yes, please. So you talked a little bit about having access and having freedom to access. And do you see that's changed a lot in the 10 years? Do you see that we're making some steps going backwards with the new hemp bill that's out there and what we're doing.
Well, the
Some of
ban,
the
the hemp
laws
bill
in,
ban. Yeah.
yes,
So that's funny you said that because I was going to say, like, yeah, we actually de facto decriminalized cannabis through the hemp bill because there was psychoactive cannabinoids in every corner store across America. So we proved that people want psychoactive cannabinoids, and now they're rolling it back to only drinks and some gummies, like very low dose drinks and low dose gummies, because the Hemp Roundtable has advocated for a carve out within the ban. So it's always 2 steps forward, 5 steps back. And so, yeah, it was looking good there for a while. Obviously, no one wants hemp-derived cannabinoids with fake terpenes, and it's unregulated. There's no certificates of analysis or lab tests, so it allows for bad actors. But that's prohibition's fault. I always say molecules are innocent. It's formulations and operators that are guilty. Delta 8 did nothing wrong to you. Amphetamines and opioids did nothing wrong. Kratom, mitragenous speciosa, there's nothing wrong with these things. It's when you make semi-synthetic compounds, call it a proprietary blend, and people are having seizures and getting sick from it. That's when it's a problem. We have a year to figure out if this hemp ban is really going to go through. Some people are skeptical that it's going to hold, so other people are preparing for it to go away. But one thing, like I said, that we did do, we de facto decriminalized cannabis in the United States, and no one talks about it. You can get Delta 9 THC ordered from Amazon to your house tonight. And that shows proof of concept that the country is ready to get high and to have access to this plant. We just need to do it in a regulated way that's safe
agreed,
and not
100%.
overtaxed.
Agreed on both of those accounts. I think that's really important. The industry has changed a lot, for sure, in the 10 years that I've been here. And I find that the recreational market has definitely taken a new stance towards higher THC and not all cannabinoid inclusive in a lot of products. And I think that we need full cannabinoid therapies when we're talking about engaging with this system. That's what it was intended for. I believe this plant was created for the purpose that it knew our body, whoever created it, however it got here. I don't claim any one way, but I believe it was needed for our system to keep it regulated.
Yeah.
Do you have any thoughts on that?
I hate to sound negative, but this is a culture problem. We can't even get people to eat healthy food or understand that American cheese is not even food. It's called a food product. We can't ban Red 40. We're still using hydrogenated soybean and seed oils and everything. People are getting extremely high off of opioids and alcohol. People are binge watching Netflix, the porn addiction and loneliness epidemic. I mean, we have a bigger problem. So I find it a little hard to ask folks to kind of build a literacy around that when they're not even really buying organic, So it's something that I do believe. That's kind of why I do like to carve cannabis out from recreation, because if we do keep having a conversation about it from a medical perspective, but then look at like Ozempic, people don't want to, some people are taking Ozempic instead of just exercising. So this is an issue. This is a cultural issue of us just wanting to take a pill and fix things. We don't do full spectrum in a lot of things we do. People are still using Roundup on their lawns instead of organic pest control. So unfortunately, this is a larger issue around laziness, intellectual laziness, and also corporate greed at the top, at the highest levels that are allowing for big pharma and these, the chemical industrial complex to just come in and solve these problems for us. General Mills and all these horrible foods that are making us sick. There's no real regulations around that because it's free market capitalism. So I feel like we have a long way to go just as a culture around just even understanding how our bodies are made, and that you can't live off of Oreos and beer. Like that's just a big gap that we have as Western culture, where we just think that we can live these full, beautiful lives without actually having, trace minerals in our diet and whole foods in our diet. I mean, I taught in public schools in the Bay Area where they didn't even know that ketchup came from a tomato. They'd never seen a kiwi. They didn't even know what some of these fruit were in their whole form. They knew orange juice, but they'd never eaten an orange. I mean, this is a major, major issue around, the corporatization of our food and our health systems that is trickling down to our ability to advocate for a whole plant medicine in cannabis.
Very well said. Thank you very much. I'm glad I asked that question because it was not one that we had even discussed. So I'm glad that I asked that question.
Well, and I will nuance it too that I'm a hippie. I went to UC Santa Cruz. I grew up in the Bay Area. I lived in Berkeley, I worked at Whole Foods and these natural food stores and things like that. Like there are people like me, and you that are highly educated that make, a good, decent amount of money that are between the ages of 40 and 60. We are the target audience that we are going into some of these stores like Sprouts or Whole Foods, and we are are paying 50% more for the granola because we turn it over and read the back and it's the grandmother's recipe and it's single sourced raisins. And like there is a subsection of people that have that literacy, that want the Manuka honey from Kauai that gives back to the indigenous farmers, and that is transferring into cannabis. So people that like Jetty, because it is I'm thinking about Jetty because I have this right in front of me, that they're a family owned business, or like, a lot of these, Hello Again, run by Lisa Williams. It's a woman owned brand by someone who lost her husband. Like these stories and these things, there is a subsection of people that are sick of corporate cannabis and do want to have a story behind it. So there is some hope. We have seen some people move to organic. We have seen some people who are spending more money to do these community supported agriculture CSA boxes, that are choosing to go to the embarks and these higher level dispensaries instead of just this like trap random delivery service. So it is out there. We just need more people to come into the fold.
That's where we need to build a bigger collaboration as well. This is the thing that I find within this industry that's a little bit frustrating, is everybody's like, this is mine and this is mine and I'm over here doing this. And that's what brought me where I am now doing what I do, is that I'm just one person. I can't service 8 billion people. And we need to be a collaborative, and we need to know that the people that we're working with have the education, the sources behind them to bring this forward. And when we collaborate, that's when we're going to be able to move this forward. When we're trying to do it all individually, we're never going to move it forward. We need a big force to make change, because we're fighting against a very wealthy machine at the top. And it's going to take all of us working together. And coming from the medical side, I see that we have to make sure we're not going down the same track as they did. It's just getting in behind the pharmaceutical companies and letting them take over. I want full plant medicine. I want to choose where it comes from. I want to get organic grown. And it's really important that we fight for what we need for our medicine. So thank you.
Well said. It's been an honor talking to you today. This has been a really refreshing, heartwarming, and inspiring conversation. And I hope your listeners got something out of it. Folks can always reach out to me. It's just my name at Gmail, Luna Stower, or lunastower.com. Excuse me. I'm Luna_Stower on Instagram. I'm Luna Stower on LinkedIn, and I'm always open to answering questions and making connections to some of the beautiful folks that I mentioned. I'm here as a connector. Normally I'm wearing a plug around my neck because I like to call myself the plug. If you need a thing, I know a guy. I'm a Yenta. I was raised by Jews. And if it's like, oh, I know a nice person for that. It's in my blood. I love to match, make, and connect. And, so that's kind of what I do. So please don't hesitate if any of your listeners are curious to learn more. I'm all open ears, and my door is always open to your community and to you.
Thank you very much. I will definitely put all of your info in the bio underneath this recording so that they can get in touch with you, because Luna is someone that we wish everybody knew. She's out there fighting for every one of us to have access to this plant around the world. She's not just doing it here in the US. She's traveling around doing it for us. And I'm so thankful for that. Is there anything I didn't ask you today that you feel we should discuss before we sign off today?
I feel complete. You're a fabulous interviewer, and this was an incredibly insightful. We touched upon every element of this plant, and the only thing we didn't say is, grow your own. Get a couple seeds and create a relationship, even if it's in your closet or your bathroom or your bathtub or on your little patio. Just try to create a relationship with this plant. It is such a beautiful plant. She has so much to teach us. Even if it's just hemp, even if it's just a little hemp plant, it's all the same plant. It doesn't have to flower and get you high to be a special plant. This plant has more terpenes than any plant on the planet, and terpenes are the most commonly found natural compound on Earth. So she is the queen empress of all living things. And if you don't have a relationship with her, I highly recommend doing that, or contacting one of your favorite farms and asking for a tour and kind of showing up and just trying to be as close to the plant as possible, because they're trying to disconnect us from nature, and you cannot criminalize a plant. It's audacious to assume that you can.
Well, thank you for being here. I really appreciate it. It was a great conversation, and I'd like to do this again.
Let's do it again.
All right.
Happy holidays, everyone.
Thank you. Happy holidays. We so appreciate you dropping in. Your time and support are invaluable as we strive to educate and advocate for the transformative potential of medical cannabis. Remember, you have only one health and one life, and no one lives them but you. Let's continue this journey together. Subscribe and hit the bell icon to stay updated on our latest conversations. Your comments and engagement fuel the dialogue we need to create change. Until next time, stay empowered and keep exploring the wonders of your endocannabinoid system.